Welcome to the second episode of the Wound Care Legends of India, a vodcast series brought to you by Urgo Medical and FootSecure. Here we delve into the journeys, insights and contributions of the pioneers of wound care in India. Today we have someone with us whose career has spanned decades. He has authored several books, contributed to almost 60 chapters and authored more than 220 plus publications, 220 awards and orations, 350 plus lectures, and he has trained more than 3,000 people across 83 countries. He is a renowned plastic, reconstructive and microvascular surgeon, where his expertise has shaped the landscape of trauma and wound care in India. He is none other than Dr. Raja Sabapathy, Dr. SRS, who is the founder of Ganga Hospital at Coimbatore. Sir, the first time I heard about you was when the diabetic foot workshop was being done here and the conference happened here. And I really wanted to come to Ganga and actually learn the preventive offloading surgeries that Ganga has been promoting. And when I spoke to Madhu about it, he gave me your email address, which itself was unique. Okay.
Raja Hand.
Raja Hand at Gmail. So how did it come out? What was your passions? Because your email itself talks about your passion as Raja Hand. So how did you get interested in hand surgeries?
Hand surgery. So I think that goes back to the time when you choose a specialty. So normally you choose up hand surgery as a super specialty, that is after your surgery. So what happened was, when I was doing my MS general surgery, then you rotate between neurosurgery, cardiac surgery, every rotate. And I rotated through neurosurgery. And then I found I was working with one Dr. Narendran. So he had just gone to Japan and come back. And at that time, I'm speaking about 79, 80.
Yeah.
Okay. So he had come back at that time. In Japan, they were trying to find a solution for stroke. And that solution was the anastomosing middle cerebral artery to one of the superficial temporal artery. Okay, so obviously it doesn't work, but then that's one of the pioneering work they were doing. And then when he came back, that Narendran wanted to do it, but they wanted to do a very safe one. So already established stroke, nothing will happen. So he wanted to find out whether it can be done in Chennai. So I was posted at the time, I assisted it.
Oh, okay.
So he was always telling me, you will be the first chap ever to look under the microscope in neurosurgery. Okay. So as soon as I saw, I thought, oh my God, no, it's so big, it's so nice. So looking at the microscope was fascinating. And that evening I went back to the library and read Yasser Gill's book on neurosurgery. So I thought, oh God, no, this is what the future is. And at the same time, the first CT scan of India came to Chennai.
Okay.
So actually very surprised to find the first CT scan of India
was in Chennai.
In Chennai, that's in a private sector, KJ Hospital.
Oh, okay.
KJ Hospital. So my Professor Sarachandra, he is known to Dr. Jagdish, and so we had a patient with Conn syndrome. So asked me to, so as a free case, I went along with the patient to take a scan. And when he came back, I put the combination of microsurgery and CT scan. So I think neurosurgery is going to be revolutionized. So I wanted to become a neurosurgeon.
Oh, okay.
I just was passionately being a neurosurgeon. And as luck would have it, when our first baby was born, then I went back to hostel. And my roommate became a plastic surgeon. Dr. Niranjan Kumar from Dharwad. Okay. Now he's the head of their institute.
Okay.
So I used to be reading his books, and I used to tell him I want to do microsurgery. Then he told me there is more microsurgery in plastic surgery than in neurosurgery.
Okay.
That's how I became just to do microsurgery, I became a plastic surgeon. So awesome. At that time, microsurgery was being done by Dr. Venkateswamy in Stanley. Okay, that's the only place where so I just went over there. I think that's how I took up hand surgery.
Okay.
So funny.
So microsurgery was the passion, and that's when the hand surgery
because
came in.
The only place where in the South India, in a big way, the microsurgery was being done was by Professor Harvey in Stanley. And there, once you go, I think that it was hand. and it was very fascinating, so I became a hand surgeon.
Awesome. So probably that's why you're known as Hand Raja instead of Raja Hand. Good. So you spoke about Stanley. I said that you finished your MBBS at Stanley, kind of a thing. So as we get into your college days, even before that, you were born in Salem, but did your schooling in Coimbatore.
Yes.
So how did tell us something about your early childhood days, Salem days, and then when you did your schooling in Coimbatore.
As when I was born, my father was he also had early marriage, and he had just finished his house NC and all that. So I was going to be born, and he wanted a job. So Coimbatore was not our place.
Okay.
Okay. My father belonged to Trichy, and my mother belonged to Salem.
Okay.
So yeah, just as in those days, you all get born in everybody delivers in their mother's place.
Yes.
So I was born in Salem.
Okay.
So my father was in search of a job, and then news came that there is an opening in a municipal hospital, small hospital, like a clinic. There is a job is available here. So is it for job security because the child is born? I think we came to Coimbatore.
Okay.
I think that's how we came to Coimbatore. But whereas
And then you made it your home.
And then my father had a good practice, started this thing, and then throughout my all our living, from the time we were born, I think it's been in Coimbatore.
Wow. So when he was working in a hospital here, and he was also practicing, and that is how your interest into medicine came in.
No, my mother actually said that we had to become doctors.
Okay.
We had to become doctors. I think it's just like farm boys go for farming, like that. So just like there is, I don't think there is any other option.
Okay.
From the very beginning, you said so. We thought naturally we had to become doctors. Okay, so that way I went in. But my father really wanted to become a surgeon, but he didn't. Okay, so he said the best thing that you have to do is to surgery. So that's how. So even in our school days, if anybody asks you what you want to be, I used to say you have to become a surgeon. Okay,
Awesome.
That's how the surgical thing came.
I also heard that you imbibed your values of honesty from your father and hardworking from your mother. Can you tell me something more about that?
Actually, my father is a great man in the sense. So a lot of people ask us, what is the best thing your father has given you? Okay, that's right. So every father gives a lot of things to you, but one of the important things he gave us was integrity. So I have never known my father do a thing which he knows is wrong. Okay, for whatever circumstance happened to be, so we have seen a lot of circumstances. Initially, you stay. I remember an incident quoted many times also. We started a hospital. So there was a very lot of struggle, I think, because he was an anesthesiologist starting a hospital. Okay. So I started a hospital, and then sometimes we may not have patients. So I used to be studying in Stanley Medical College. I came home. And then one of the things you have to do is, as soon as you come home, you have to go to hospital. So that was the way we are. So there are only about 2 patients in the hospital. Okay. So when you're coming, he was telling there are only 2 patients. My mother was telling there are only 2 patients there, and hope that we don't become empty. Okay. But my father, I went along with my father to the hospital, and then he saw them, and he knows pretty well. And then he found that they are fit for discharge. So they all right. Then he immediately said, "Now please go home." Then the next patient also he saw, and then they were all right. He said, "Please go home." Okay. So then I was feeling, oh my God, no. So that's what exactly they told. They were going to become empty. Okay. So the count will be 0. Okay. But I asked him, then will be 0. I told my father, yeah, that's okay. But what to do? No, they are fit to go. They have to go. So I think that was very nice. So in acts, big and small, I think they are delivering a small sort of message. You just need to do what is right. That is one. And secondly, they also told us, if you think it is right, you also have to stand up for what's right.
Yeah.
Okay, you have to stand up for what is right. Now you need to express it. You need to disagree if things are there. But then in a way that is, you should disagree without being disagreeable. You just have to put your point and say this is what, and not be cowed down by any circumstance. I think that's the way. For my mother, what you have to say is that she gave us a lot of push for me, excellent. I think with her, not being first is not an option. But now, if you say, people all will say that's wrong, no?
Yeah.
They say it's not wrong.
Yes, absolutely. Today's generation
will not agree, no? Then nobody will agree. So, with her, no, we had to be number one.
How strict was she?
Oh, terribly strict. Very, very strict. Strict beyond. Now, if you don't say how you
Any examples?
Examples, we were brought by hand.
Okay. Okay.
We were brought up by hand. Okay, so that means anything, if we do anything, we say whatever she had in his hand will be honest. Okay, so that's it. And but now I really think, I don't know, that's the magic actually, because now if we tell, I think even if I tell my grandchildren or something, and or if we have talk with our doctors and their wives and all, they always say, no, you can't beat children.
Yeah.
Okay, and you can't be very strict. I think they'll rebel. All these things they're telling. But I think what the charm with us was, she was extraordinarily strict, but somehow we felt that it's for our good.
Okay.
I don't know how to make that combination. I was trying to work it out. I think when you are very strict with somebody, okay.
Probably that love was there,
and then,
the strictness.
Yeah, that's right. No? But you didn't, but you were very sure they are doing it for your good. Okay, so in that way, we didn't really rebel. And my mother used to say, another thing is implicit obedience. There's, just do it, mean do it. That's it. No? So she used to tell us, if I tell you jump into a well, you have to jump into a well. Okay, that's it. Okay, and you have to be fully confident. They should be asking you to jump into a well for a good reason. Okay, you should be sure they will bring you out or something. Wow. So there is no question of
no logic behind.
No, that's right. No, it's implicit obedience. Okay. But now I don't know how much we will all be able to bring it up. But I personally feel, if your mentor is very good and he really means good for you, okay, the implicit obedience is good, I think. So there, I think if you really, not everybody will have some flaws. Nobody can be perfect. But on the whole, you take, I think if you choose a good mentor, and mentor is also loves you so much, that means implicit obedience, I think, in the end.
I have not been beaten as such, but I still remember during my PG days, post-graduation, my professor, we were held as a general surgeon, we used to hold retraction. And if I just loosen it a bit, he used to hit it on the knuckles, and still with that pain, we had to hold it. And that's the kind of learning. I can't imagine that being done with today's surgeons.
If you do it, it'll be in Instagram and WhatsApp.
Yes, it's like most toxic department, and all those things will come out. So you hit upon the origins of Ganga, I suppose, when your father started a hospital. Was that the origin of Ganga hospitals?
No, actually, my father started to practice in 1956 here. Okay, 1956 he started, and then he always thought that he has to have a hospital. Okay, and he was an MBBS, and an opportunity came for him to go to UK because he was secretary of the Shasho Homes. That's a home for people who are sick and all that. It's a charity brought up by one Leonard Shasher in UK after the Second World War. So those days going abroad was extraordinarily difficult. So he had an opportunity to go. Then he thought, my mother said, you're going there, we need to specialize in something and come back. No? Okay. So they said, and then he hit upon, and then he made.
So was that also in obedience?
My father, they discussed. I thought, no. My father had a really, really, really tough time. When he just go there, not much money. I think amazing. Amazing means amazing. The way he really made it happen. So he completed his D and came.
Okay.
So there, I think it's a sort of a disruptive idea. See, normally anesthetists go to surgeons. So he thought that he had a roaring practice. He had a roaring general practice. He was a very extremely popular man. So he thought he would have a hospital, and then he'll make surgeons come, so that he'll always be there.
Okay.
That was his idea. So I thought whether it'll click or something, So it took really a long time to click. I think, to be honest. Okay. It was, I think it was an idea too early for a time hospital. Okay, so it was, that's how he said in 1971. Okay, in 1972 it started. So in 1972 I joined medicine. Okay, so at the time when I joined medicine,
The hospital also started.
Hospital also started at that time.
And how about your brother?
Yeah, my brother, no, he followed about 3 years behind me.
Okay.
2.5 years younger than me, so I followed 3 years. So, same thing, there's no choice.
No choice.
No choice.
So in Stanley, how was your, were you a front bencher or were you a last bencher? Were you, how was your life at Stanley?
Stanley life was great in the sense, first time in a hostel. Stanley, I personally feel, is a sort of, it didn't have much of rich people. It had a lot of rural, all the important city people were in Madras Medical College. Stanley used to be called Salem Medical College, in the sense, people around Coimbatore, Salem, that area, used to be there. Okay, there's there. And Stanley has always, there was very strict ragging. Oh. Phenomenal ragging. You just can't believe, phenomenal ragging. They have to have ragging up to one date, one particular date. So up to that, we all used to have ragging. But then, in that process, also made a lot of friends. Everybody knows everybody. Okay, so everybody knows everybody. And there, you have to, I personally feel it's very important to pick up good friends. So I picked up 2, 3 good friends. So one, Dr. Srinivasan, is now in Salem. Then Dr. Jaishankar is an orthopedic surgeon, who is in head of the Sundara Medical Foundation, Chennai. So we all became roommates in the second year. Okay, and we continued on till the house agency. Okay, no changing this thing. We just went through the same way it went through. So and we developed a lot of good friends. I think that was.
And you also won about 25 awards during your undergraduation. Tell us more about it. I haven't seen someone winning all the 25 awards there.
Yeah, I think that's.
Were you the gold medalist and the topper all throughout?
Yeah, we had a good amount of competition, but really what happens was probably I picked at the very right time. So in anatomy and physiology, I got only certificates of one. I didn't get the first prize. And third, pharmacology, I got the medal. So from then...
forensic also.
Yeah, forensic. So from there I took on. Probably I think what is called as a peaking at the right time. So when you final year only, there are more prizes. And there are a lot of prizes for intercollegiate and all are there. So probably you peak at the right time.
Wow.
Very good.
So were there any teachers or mentors that you saw in Stanley that kind of influenced you during your MBBS days?
Yeah.
Or was it only your father telling that you need to be a surgeon?
Yeah.
Or how was the...
it's, I would say, it's a sort of a lot of combination of things. So because at home, you are being told that you have to do this. And my mother used to continuously write letters, get going. So and then we are so good friends that I used to share my letter to all my roommates. So when my mother writes a letter, everybody used to read. So everybody used to read. So we are so even now we are very close friends. So used to read, and all of us did well. Okay, so that was one. And secondly, there are, of course, not much of distance. So you are very focused. My friends were all my friends were also very nice fellows. All of them were also studious. One was the captain of the hockey team. Okay. So like that, one other fellow was the captain of the football team. So like that, all of us excelled. Okay, and so they are used to happy with this. With my studying, and then we used to go cheer him when he plays the matches. So that was it. In Stanley, the other thing was we learned as much from our colleagues as this from teachers like that. So our seniors, they are also very nice. A lot of seniors used to help you because you're in the hostel. Yeah. There, once the ragging is over, then after that, your big comrade brotherhood comes. Okay, so
that's something that we miss. I know the ragging went to its peak of where it had to be banned and everything, but we still
No, I think that coercive ragging is bad.
Yeah.
Coercive ragging is bad. I think
that's what it went to a completely negative aspect.
It went into a very negative aspect. It went in. So I'm not justifying ragging. I only say it was there.
Yeah. No, it was there in my time also when they had just joined in. But as I said, that limit crossed and
anything that crosses the limit is fine. But as my Madras Medical College, my general surgery professor, Professor Sarachandra, I think he was the great mentor. He was a great mentor, and Dr. Vittal, Padmashri Vittal, he just passed away. He was the president of the ASI. So he again was a great mentor. So Dr. Sarachandra is an ocean of knowledge. So, and he really had a wish that we all should come up, So the main thing which really, what I got from those was they were all extremely broad-minded. So they were all thinking bigger. They're thinking wider. Okay, not with them unit or something like that. No, that's not it. No, they are all thinking in a wider way. So it also broadens your vision.
Absolutely.
So I think that's very, very important. I think if you have to, with whom do you work?
Absolutely.
Okay, that's very important.
Absolutely.
Suppose if somebody keeps on telling you about negative aspects of it or cynical or just whereas I think God has been kind, that's what I say. If I'm a house surgeon, if they say surgical posting, this unit is the best, I think by some chance I'll be in that unit.
No.
Okay, if they say if in final year this unit is the best, not that anything is there, but when they put the order, okay, I just was in the right places and we really made use of it. That's it. No, that's really
Awesome. And so I'm just jumping back to Ganga Hospital.
Okay.
So tell me more about after you came back.
Yes.
So we'll delve into your PG and your studies in UK and US and other things as we go along. But once you came back, and what inspired you to set up the Ganga Hospital? I was also reading one of your books where it said that you used to call the anesthetists, and that's how you met Dr. Ravindra Bhatt, kind of saying. So can you just take us through, once you are back, what was your vision for Ganga Hospital and where it is now?
Yeah. So one of the things which really, I should say, molded me and which helped us to build up Ganga Hospital the way, my contribution in the way, is my stint in the US. So at the time, I think US was fantastic. Fantastic is the word. So what they call as the true American spirit. Like embracing everybody and go for anything is possible. So there's nothing like, it's not possible. Everybody feels everything is possible.
The country of opportunities.
The country of opportunities. I think it was a great country of opportunity. And at the time in Louisville, when I was there, I think that was one of the best phases of Louisville. And Dr. Kleinert and the whole team, they were all in their peak. Like at that time, you were also there. And it attracted a lot of other people. So when you come back with a feeling, this is possible. So we just have to create another Louisville. Okay, it's easily possible to create Louisville. No? So that it is difficult, it's not possible, that is not there at all. The only thing, it's possible, it's going to come. It's like that, it is there. And the client, I used to ask him, a lot of talks we used to make. I think this is what is called as a great mentorship. So how do you make a good hospital? How do you make a good hand surgery center? He said, remember 3 A's, he said. The first A is availability. Okay, second A is affability, being nice to people. Third is ability, and said in the same order.
Okay.
That's very interesting. In the same order. Okay, first is availability. Okay, next is being nice to people. I think you have to love people. Okay, you love your patient. Third is ability. But of course, ability is taken for granted. Now you can't be an idiot and then be a good surgeon. But even if you are a very good surgeon, okay, not necessarily you will create an institution. The first thing is availability. So that part of it, the availability was in my back of my mind all the time. Okay, I think that created, because what happened when he came here, we had a very small hospital. We had 35 beds. There were four.
So
five.
from 5 to 35, how did it go?
5 to 5 was my first, 72. When I became a house surgeon, at then 78, then we got a small land and then 16 beds. Okay. So it was our bed. So I think it also coincides with my
milestone.
When I joined my medicine, we started the hospital 5. And as a house surgeon, it became our hospital at 16. And because we are coming back, in 91. In 91, when you are coming back, my father said, because both of us are coming, we need a little bit. So I added some rooms and made it to 35. And 4 operating theatres were there.
Oh, for the 35 bed itself?
We had 4 operating theatres. Okay. No? So we said 4 operating theatres we did. So at that time, 35, there are four or five institutions in Coimbatore which are 400 beds.
Oh.
So, and we are coming here and telling that we'll make major injuries. So a lot of people said, no, major injuries will go to major hospital. How will they come to a small hospital? Okay, but somehow I felt, no, it will come, no, it will be here. But because many said, you please do some sessions here with us. But I thought, no, suppose you are there and then somebody comes here, you are not there. What happens, no?
That availability.
Availability, no. So he said, what is it? And then our parents struggle so hard. It's not fair to go to another place. Okay, so whatever it is, we'll be there. Okay, so we stuck. I think that was a real good move, one. And second, the reason for growth is availability. So we are always available. And 24/7, 365. So suppose if I finish work, those days were very hard work. 5 o'clock start operating, 10 o'clock finish, and after that emergencies. Like that, no? Even if I go home at 10 o'clock, if somebody comes at 12 o'clock, okay, I'll come back. Because for that patient, it doesn't really matter, no, whether you go home, you went home at 10 o'clock. And you finish at 12 o'clock and go, then 4 o'clock, another floor, you can come back at 4 o'clock. So, because as far as he is concerned, he doesn't, it's a damn that, no, you went at 10.
That's for a different patient you went back.
Yeah, that's right. It's a different patient you went, because we are talking everywhere. In the sense, you have to come immediately, And I think I also used to think, so suppose you tell him from a village he is coming, that means he gets injured. If he is reaching at 12 o'clock, that means he is injured at 7 o'clock. He caught some rickshaw or somewhere, goes to this thing, catches a bus, catches an auto and comes here. And then you come and say, no, okay, sleep, it doesn't really matter. No? So the availability part of it, I think, which really made us win.
Yeah, so from 35, then how did it grow further?
Because we introduced microsurgery to the region, and then next thing was my brother being an orthopedic surgeon, we worked together. Okay, because we worked together and we made orthoplastic procedures, and that was not being done in the whole country. I think that really brought it up. And in 6 years now, we became 135.
Oh.
In 6 years now, we brought our next land and made it to 135. But I would say the first 10 years were our best 10 years, in the sense with working with limited resources, okay, and gaining same results as what you would obtain. So even here, when we were working in that limited resources at Ganga, I never used to think that we need to get the outcomes of what will be done in another hospital in Coimbatore. I always keep thinking, how do we get the same results what we are getting in the US? Okay, so our benchmarking was not the local competition. The benchmarking was what was that we are getting in US. I think how do we get it the same thing here? Yeah. So then we have to do a lot of disruptive practice adjustments, what to do, how to make it with less resources, but not to compromise on the outcome that you set. I think that really won the game.
So at the Ganga Hospital, I see that it has been inspired by your tenure in US, inspired by Mayo and also inspired by Arvind here. So what are the things that you got inspired from Mayo and Arvind that you brought into Ganga when in your setting up of Ganga?
Yeah. So Mayo, I got inspired very early. So when you're in Stanley Medical College, I used to love to read books. There's one Moore Market where you get books at 1 rupee.
Okay.
1 rupee shop, 1 rupee a book, old books. So there I went and saw the one book, Dr S Mayo. I bought that book. I think that's the best investment I have ever made in my life. Okay. So that was an amazing book. I think that tells about the life story of a book. And then it tells about how in the middle of nowhere, how they created a major institution. So I read the book and then brought the book. I told everybody in the house to read it. I asked my brother to read, my mother to read, everybody to read.
Wow.
Then said, no, it's possible. So that gave an inspiration that, no, that's good. And then it had, they gave a lot of patient care. They grew and a phenomenal amount of ethics they had. One thing that struck me was, steroids were found over there. And the thyroxine was synthesized there, and there are 2 Nobel Prizes won. But then, no, they did not patent it, no. So just imagine if they had patented their trillions, these two important things. But then they said, no, it's for good for mankind. It has to go. So like that, there are a lot of things in that book. I took a lot of things as to, I think it's very important. That was a good thing. So that means it happened to me when I was in my third year of my medical college.
Okay.
So that is it. So I always tell people now you read a lot of books, read a lot of other things other than medicine. This is the one which will really make you. And what we got from Aravind, I think that again was a very important thing, because we came back, I thought having a microsurgery will immediately practice will boom. Nothing happened, no practice. Okay, nothing was there. So I was attending an ophthalmology meeting, and there one Mr. Tulasiwar, the executive director of Aravind, he was talking about how Aravind started. So he was telling that in India, only 8% of the cataract blind were being operated. So the Aravind concentrated on the 92%. Okay, then I was listening to that, as he was speaking, I was converting it to hand injuries. So then I found, okay, I went at the end of it, I asked him, so do you think it will be the same thing with hand surgery? Yes, in India everything will be the same, he said. Okay, then I said, okay, I think we should not worry about what goes to other offices. I think we should think, then we made a brochure, okay, how to reach hand injuries. And no matter what we do, whether they pay, they don't pay, and all we'll do. Okay, then I think that's the way Aravind was a great inspiration for us.
I see that your OPD block and other things are also constructed as a Mayo thing, where the doctor doesn't sit in one place, but they go.
The Louisville thing, Louisville thing.
Yeah.
So in Louisville, normally we have a consultation room. So in Ganga, you will find the doctors don't have consultation rooms. So we have a lot of cubicles we have. And we also find our patients, they all come with dressings and all. They all come with dressing. So if you have to have a consultation room and they occupy your space, then you dress, finish, and then change the dress and go. So here, if you have a number of consultation rooms and you walk between, so somebody could keep it ready. Okay, you explain everything, and after the dressing can be done. So your time is much more. I thought it was an extraordinarily efficient use of time in the US. So Louisville, they had it like this. So
how is it working now here? Because I see very less of these kind of setups in India. Even today, you don't see that doctors walking to different cubicles.
But if you have a volume, I think it will work very well. No, see, if once you pick up volume, so it's very, very important. Otherwise, you cannot manage.
Yeah,
if you have to see about 50 patients, 60 patients or something in 2-3 hours you want to make and still be good, still make satisfy them, then you can't be sitting in one place and satisfying them. Okay, so in this way, you can get out anytime you think there's enough. I think we are done this and you got out.
So coming to your favorite topic of microsurgery.
Yes.
You established a microsurgery lab here.
Yes.
You started working with Dr. Ravindra Bhatt on the anesthesia part of it, where he was pioneering in regional blocks.
Yes.
So how did this come about?
Yeah. So when we came back, regular no surgery lasted for 2 hours. Like most of them, except in pediatrics surgery. I think no surgery was there at that time, 90s. So here, our surgeries were lasting too. No anesthetist was willing to come. So I thought we need to have somebody who will be with us all the time, and it's extremely difficult to get. Bhatt was my house surgeon when I was working in between times, between MS and MCH.
Okay.
So I knew he was a good boy. So I met him in a wedding reception. I said, why don't you join us? So on a day when no anesthetist was available, when one patient I had to operate on him. So I called him.
Stephen, right?
Stephen. My name Stephen. He had a tea crush injury, full of mud, full of tea leaves in the hand. He really required about 3 to 4 hours of debridement in the middle of night. Nobody can. And then I called him, and then he came and gave the anesthesia. So then I told him, no, stay on. No? So one thing good about Bhatt was, he did whatever I said. That is an amazing thing. So he just truly believed me. Okay, and a lot of people I said, please join us full time. Okay, nobody was willing to join full time. So in those days, it was not. I think we were very small. So nobody believed that it will become big. Okay, so Bhatt believed it. So I'm very grateful to him. So he started it, and only surgeons were giving blocks those days. So I thought it should be good if the anesthetist gives blocks. So it also happened, so bad thing happened. One senior surgeon one day called me and said, I want to operate on a decurrence. Okay, on a VIP patient. He's got a lot of compromises. Can you please come and give a block? I felt very distinguished. I'm a surgeon.
Yeah.
Okay, it looks so bad. That means he's calling me to say, give a block. Yeah, because then I did do that. And then I decided, there's the last ever time I'll give a block. Okay, I will not give a block. Okay. And then we had to make anesthetist give block. He came back and said, anesthetist, give block. I said, no, sir. No, you give block. Okay. Then I found that's one of the good decisions we took. And we said that no matter, even if it is a digital block, I said I will not give. So then that had a big thing. So if a child has got a small injury,
Yeah.
Okay, give local. I said that also will be given by an anesthesiologist. So in the sense, what happened was, in anything we did, they also had a share. Correct. So then what happens is you become a team.
True.
Okay, so I think that again was a big thing. So I would say they're all small incremental, advanced incremental things that you have, and but then together. But I must tell you about how did this on-arrival block came, no? That which really now is being spoken about so big, it has become a big thing. So we had a small place in the anteroom of the theatre, and we didn't have a duty doctor. We didn't have doctors. Those days very difficult to get. It was not possible to get, and the load nobody is getting. So every injury that came, was being sent to theatre. My job was to do the operating, but job was to receive them. And the next patient will do operation, he'll be there. And some dressing for one fellow who had come for follow-up will be there waiting. And a new fellow will come with a lot of blood-soaked dressings will come. And you can imagine what a mess it will be. It will be a mess. And they'll be shouting. So just to make these fellows not shout, but give a block. Okay? But give a block. So that when you open the dressing, because there is no other way, I can't change and go down. Okay, see, in between. So then we found it's phenomenal, no? It works wonders. Okay, the patient comes 200 miles, he comes with pain, comes to Ganga hospital, 5 minutes, no pain. Okay, so I thought this is a great hospital. Okay, so that's one. And secondly, we are able to take x-rays better after the block, because we keep it position, and that we did. But then, what really made it possible was, a couple of times after we did, but told me, sir, there is a problem in this. Because blocks were not common those days. Like we are only giving, they're not very common. So once you give a block, the hand gets paralyzed. And if you open the dressing and then you tell that this is, you have to do all this, and the patient says, I don't want, I'm going back, then we can't discharge him.
Until the...
And then it became too big a thing, because anesthesia fellow going out of hospital. I think there's a big thing, it's a risk there. Then I was just having coffee, just sitting like this having coffee. Then I told, but look here, now we are the best in the business. Same word I use, we are the best in the business. And if a fellow comes to us and then he says he wants to go, the only reason could be money. Okay, there can't be anything, any other reason. That means then we'll operate that fellow free. Okay? So, but then we will not give this up. This is a great thing. Okay, but I am ready. He said, are you okay? But said, okay. Okay, so I think it is, I still remember those few sentences, few minutes. I think I would say that's a big giant leap for anesthesia. And surgical care.
And most of your decisions, I think, is just without any planning. Even buying your microscopes, Carl Zeier's microscope was also without any planning.
So it is just that now, but once that said, then after that now all go. So then we improvised upon things, and then what to do. And then I just coined the word on-arrival block. Okay, so it's a surgeon who coined the word. So, and now it became very popular. And now our anesthesiologists have taken it to great heights. Femoral fractures, they give block for any fellow, anybody.
Yeah, Ganga has been known for regional blocks.
So now they have really extended it on to heights. But then the beginning was a small candid conversation that happened out of necessity.
Absolutely. So coming to wound care, so you have not moved. You were a hand surgeon, then came into diabetic foot conditions, burns, and other things. So how did it all come together, and what interested you in diabetic foot surgery?
Diabetic. So we are. How it happened was, see, when every time a new fellow, a consultant joins, I always used to think, what were the vertical growth opportunities for him? Okay, so somebody joins and all. So every time someone joins, I was thinking for something new. And I knew what was all there. So in fact, when we first started, I had a lot of aesthetic surgery cases. Okay, my God, no. Because a nice doctor come from America, talks very nicely, talks pleasantly. My great referral people are all gynecologists.
Okay.
All of them for abdominoplasty and all. But what happened was, we used to have a patient abdominoplasty or for some aesthetic surgical work, rhinoplasty or something. And then a major crush injury will come. A replant will come. Then I'll say, okay, I have to do this, and then I'll do tomorrow or a little evening. Then evening I'll have another chap like this. So like that it
the
goes
aesthetics
on.
kept on getting
But then they all get angry because they had planned only for 3 days leave or something like that. They are not bargained for this postponement. They would have seen good times and all that. Then they all started. Then I started thinking, oh my God, we shouldn't get aesthetic surgery cases. If somebody case comes, oh my God, I used to feel so bad about it because my load was so high on this. But like that, when one person comes, we used to take on. And diabetic foot, I got interested was from the very beginning something challenging. Like something very difficult cases, I used to feel somehow we had to take care. And I used to find somebody amputates the great toe, and after some time the midfoot ulcer will come like that. It keeps on going. Then I found out in 2011, I think we started, formally we said we'll open a diabetic foot clinic. So we inaugurated with Hindu Ram. With him, inaugurated so that we bring awareness, bring it about it. And we really went into offloading surgeries. We went because we used to do flaps. We used to do this. This fellow used to come back with ulcers. And that's the worst thing that you can have. Okay? Because he takes your brain off. Okay? He just spends so much and all. Then one day we told Madhu and said, let's learn about it. So we just started reading about it fully. Then we found, when we have not done anything original, we only think we made this, what was already available literature, collated it, and then found, as a plastic surgeon, you are very well trained to do those procedures. So we just only put them all together, and then it really happened. And I'm very grateful to the Madhu, Vamsi, and the Kuman and the team, which really took on that idea. And then really took it forward. Yeah,
for diabetic foot surgery or preventive offloading surgery, Ganga is synonymous with preventive offloading.
See, it's just that it's not that we really planned it. See, one problem comes, these fellows come and we do a flap and they keep on complaining. I said, this can't happen. So I said, that's also, Sanjay, another nice thing was, I worked with Ravi Kumar. So this is exactly why it developed. When we had a problem, he's a pediatric surgeon. He used to say, suppose if you have a problem, you will not be so blessed to be the first fellow in the world to have this. Okay? Many people would have had it. Some people would have found a solution, and at least a couple of them would have written about it. Okay? So whenever you have a problem, that means you have to dive deep. I think that's a good habit. I think that's a very, very good habit.
That's an interesting take home to me also.
Take home, So you will not be the blessed by God to have the problem first time. It's very, very difficult to have. Okay, a lot of fellows would have faced it, and sadism. So whenever you have any problem, read. Okay, exactly for diabetic foot, we said we'll read. Okay, and then only we found out this biomechanical reasons for reason. Unless you are corrected, whatever plastic surgery you do, again it will come back. Again, that's the way it goes.